I'm Dr. David Remias. I'm one of the new primary care non-operative sports medicine physicians that has recently joined the Southeast Orthopedic Specialist team, and I am happy to be here. I like to take this opportunity to just give you a little bit of background about myself, sort of where my training has been and the type of patients that I would see in clinic. So first off, regarding my background, so I have a I've been board certified in family medicine and sports medicine since 2013 and 14 respectively. I did both my residency and fellowship at President's Resurrection Medical Center, which is located out in Chicago, Illinois. I have been in the Jacksonville area since 2016. And prior to joining SOS, I worked with St. Vincent's, now Ascension Medical Group, providing both urgent care and sports medicine care to the greater community, primarily in the Ortega area. As far as my community involvement, I've been a team physician for our local high schools, including First Coast Christian Academy and Nice High School. I've done volunteer outreach opportunities with St. Vincent's Medical Mission at Home, providing medical care to those in need. I've also covered local sporting events in the area. I've provided sports medicine-based education, lectures to medical staff and those in the community. I've also participated at numerous mass school sports physicals. As far as what services do I provide in practice, and as far as who do I see or what do I see in clinic, I'm going to start off by saying or showing you guys a small list of what I typically see. Now, you guys might recognize that this slide looks very busy, and that was intended to be the point, because as a non-operative sports medicine physician, I see everything orthopedic related from head to toe. And so strains, sprains, fractures, etc. I see arthritis, I see all of that in clinic. I think a common idea that when somebody says they have a particular orthopedic or musculoskeletal need, for example, shoulder pain, which is a very common complaint, they think I got shoulder pain, I got to go to the orthopedic surgeon, and that's the only option they have. And while it's a very good option, another option is to see somebody like myself who is trained to assess and treat in a conservative, non-operative fashion their shoulder pain. Oftentimes, conservative therapy will help mitigate to a tolerable level, if not eradicate their condition, and ultimately saving patients from having an unnecessary surgery. Furthermore, I am trained as a non-operative sports physician to also recognize the surgical needs as well, so that if your shoulder pain is related to a full thickness rotator cuff tear, for example, I can then recognize that and send you to one of our colleagues, for instance, for addressing your shoulder needs. As far as, who do I see in the community then, or who would be a candidate to see me in office? I see both young and old patients. I see the athletes and I see the non-athletes, or anybody with a orthopedic or musculoskeletal condition that relates to, again, the joint, bone, muscle, tendon, ligament. Yes, I also see those that are injured, but I also like to see those that aren't necessarily injured, but looking to perform better at their specific sport or hobby. Of a specific note, I've taken a keen interest to the sport of golf and have dedicated a good deal of my life trying to become better at the sport, being educated, building my golf IQ. And I feel that I can provide, sort of with my unique background, a service to the golfers in the community with regards to assessing their injury and sympathizing with their injury and helping them achieve either the rehab necessary or directing them, if not to myself, but other members in the community from other disciplines, to help them achieve their goals with the sport of golf. And as far as where I'm practicing currently, I'm at the Center One location primarily, and I will often float to either the Ponte Vedra and likely the Fleming Island location. But the plan ultimately is to be a staple in the North St. Johns County area, specifically off of County Road 210. As far as my goals with the non-operative sports medicine service that I provide to the community and with Southeast Orthopedic Specialists, I plan to provide the highest quality sports medicine, and I should add orthopedic / musculoskeletal care possible to the community. And how do I go about doing that? Well, number one, I would like to make an accurate diagnosis. Two, and probably more importantly, I need to be able to communicate that diagnosis, I find very important, and treatment plans clearly to my patients. And to also utilize a diverse team of medical professionals from various disciplines to help execute the treatment plans, because it's oftentimes not just me that helps get the work done. It's a team effort that ultimately helps the patient rehabilitate appropriately, and not just to rehabilitate injuries, but to improve my patient's performance and overall quality of life. So I think we're going to open it up for questions, but if you had any interest in setting up an appointment to see me because you have various complaints, orthopedic concerns, feel free to reach out to us at the number listed above for my team, or reach us at that email that you see here on the screen, and we'll be glad to set you up with an office visit and assessment as soon as possible. Yes, we have questions. So yes, I do perform injections, and I guess I'll answer it several fold. So I do joint injections. I can do peritendon or ligamentous injections if necessary. I do steroid injections. I also use hyaluronic acid injections for arthritis, particularly of the knee. And coming soon, we'll be doing PRP or platelet-rich plasma injections as well. So good question. With my family medicine background, I have seen the peds population. I think a good rule of thumb is that 10 and over, it's just like a shoo-in for the clinic. But obviously, if you have a potential pediatric patient at home and they have a orthopedic concern, feel free to reach out to my team, and we'll be better able to assess and triage your loved one appropriately, whether it be with my care or somebody else's. Very common. So with any acute pain, literature and anecdotal evidence too, for that matter, ice is generally the rule of thumb to start off within the acute period of time. Within the first couple of days to first few weeks, ice is always the good way to go. 20 minutes to the affected area multiple times a day, and start with that. Heat is more reserved for I'll say more of a chronic pain or muscle spasm, for example, where we're trying to alleviate a little bit of tension, bring more heat into the area, circulation to the area. But oftentimes, ice is just as effective, even for those conditions. So acute phase, rule of thumb, ice. Okay, so if you've injured your knee, the first thing I would say is to make sure that you get appropriately assessed and properly assessed. So I would definitely recommend, if this knee is ailing you, that if you haven't had a medical provider take a look at it, that you set up an appointment sooner rather than later so that we can assess it both with our clinical exam, various imaging modality, and give you a clear picture of what is going on so we can better tailor a treatment plan. If you're just looking for stretching exercises, I think a good place to start for knee pain example or shoulder pain example, go to the American Academy of Orthopedic Surgery's website, and they have a link for patient info, and you can find rehabilitation exercises for your specific joint or condition online. Yes, we do. We have X-ray. We also have at our various locations, both Center One and Fleming Island, MRI. So yeah, we have both of those available for you, but we could also get you situated with whatever is convenient for you. Often, because I think a therapist is important in the overall picture of your rehabilitation. Oftentimes, and it also depends on the injury, we will have that conversation depending on what we assess the problem to be and what we need specifically out of treatment. But yeah, oftentimes we do, because they provide various modalities to help improve the speed of your healing and to alleviate pain, in addition to the medications, for example, that I would prescribe at clinic. And they can give you an observed progression in terms of your exercises, ranges of motion, and activities, because they get to spend one-on-one time with you for several times during a week. So they can transition you appropriately back to various activities that you do on a day-to-day basis. Okay, so typically, I think it depends on the conversation and what the patient has at hand, but we like to prioritize whatever injury is ailing you the most, and we like to put that to the forefront of the picture and make sure that we get you a very thorough workup and complete assessment and plan, so that we are not skimping or missing out on potential treatment options for that one particular condition, just so that we can address several problems at once. Okay, so it looks like that's the end of the questions. Thank you guys very much for the time today. I look forward to helping make you better in clinic.